know if you need an OT, and how do you go about finding one? That is our topic here today on ADHD What Now? And I'm your hostess, Veronica Hunter. Delighted to have today Melinda Matula, who is a pediatric occupational therapist, and she is going to share with us her experience. Now, the reason I think that she's such a valuable contributor to this discussion is because I've heard so much how practitioners, once they have a child with the ADHD, they also can appreciate it from both sides, right? Both as the parent and as their expertise having been trained in that area. So Melinda has both of those experiences. And I think that her experience in that regard will share a lot on this conversation. So thank you so much for being here, Melinda.
You're welcome. It's a pleasure.
Yay. And to get started, I wanted to ask you if you would share, you've been looking for an occupational therapist for your son. So coming from the profession and then going into looking for one, can you share a little bit of what your experience has looked like there and perhaps what surprised you along the way? After that, we're going to get into a little bit about maybe some red flags that would say, how do you call one, and the whole process of accessing one, what they treat, et cetera. But starting off, what has been your experience as the professional OT looking for someone for your son?
Well, thank you for asking me that. I have to say that it has been an experience that has had some unexpected, I guess, outcomes. That things that I wasn't sure about how things would go. Being having a child diagnosed with the ADHD, and being on the parent side of it versus being on the therapist side of it is quite different. And I have to say that I think it's been the experience of not only myself, but other people who have experienced this, that initially, at least for me, I thought, well, I know what to do. I will just, create some activities for my son to do, and I'll be able to do therapy with him. But unfortunately, that's the ideal, and that's, not necessarily the reality of situations, unfortunately. So I found that my son, was not really wanting to accept me as his therapist, because quite frankly, I was his mom, right? So I think delineating those roles was very important for me as a first step to begin with, in kind of coming to acceptance with, yes, I know what to do, but my occupational role, as OTs will, understand that jargon, was being mom first. That was my role. It really wasn't being his therapist. So once I was able to understand that and learn that that was the role that I would be playing primarily, then I was able to look for an occupational therapist that would help my son, because I did know that he did need OT services. Um, Initially, I was looking to see what kind of OTs services he needed, because there are two different types. There are the services that you can get through your local hospital or outpatient clinic. And then there are the services that you can get through the educational system of your school. So I, looked primarily first to a school, because I felt that he was spending most of the day, well, with COVID, it's been a bit different now, but primarily the students spend most of the day in school. So that is a primary area where they will need a lot of assistance. And my first part of doing that for him was to explore getting it, obviously, once I had a diagnosis, getting a 504 plan for him. And once I had the 504 plan in place, then I did request, or as part of the 504 plan, request that an OT, have a consultation or evaluation to determine whether he was indeed in need of OT services in the school. And what that involved initially was an OT screening. The OT from the school took a look at my son with my permission. They sent a permission slip home and took a brief look at him in the school functioning, observed him in class, did pull him out of class with my permission to see some of his skills. And then they contacted me with the screening and told me what the results of the screening were. And based on that screening, they made a recommendation for either an evaluation or a or services. And in this case, my son's case, the OT recommended at this point doing more of a consultative model with him as opposed to a direct service model in school, because his needs were, he was actually meeting a lot of the academic needs that he needed to do in school. And the ADHD symptoms or issues were not to the level where they were interfering to a large extent with his ability to access his educational curriculum. So that's an important distinction that OTs make when we look at educational versus clinical model, or what others call medical model occupational therapy. So then I went looking again to the medical model for OT, which is more based on the outpatient clinic, which involves much more of a look at how the life skills are being affected by the ADHD.
Mm-hmm. Can I
So
just ask a clarification here? So is it what you're saying then for within the educational model, what they're looking at is how does occupational therapy relate to them accessing education? And so the scope is within access to education. And
yes,
in
that is exactly correct.
the
Yes.
clinic, it's just a broader area.
Yeah, in the clinic, they will look at things like self-care skills, and also social skills, sensory processing skills, very, very much so sensory processing skills. So, and they have different equipment there that they're able to work with this child or the student to access those skills. We do look at self-care skills. I'm a school-based practitioner. We do look at self-care skills as they relate to a child's ability to do things, for example, like put his coat on, get his belongings together in the school environment, how they relate for maybe lunch things, or getting ready to go home, or unpacking when we arrive at school initially. But we look at them within those contexts of the environment in which this child is in. And we don't really, as educational OT, we don't really do as much intervention regarding needs for the home or needs for life skills as much. I mean, there are certain students who have special education that do work on life skills as well. So there are some overlap, but the primary difference is how it affects their educational programming. And if it doesn't affect their educational programming, and that is the case with some students, is that they'll hold it all together, for lack of a better word, when they're in school, and then they come home and it's like this big release. They'll release all their anxieties or their big emotions or their feelings and thought processes. Everything gets released when we're at home, because, well, quite frankly, that is the place where that's our place of comfort, and so what I have found also in my practice, as well as in my own personal experience with my son, is that, you'll find people saying, oh, he's just fine in school. He's, okay, occasionally he gets a little upset, but well, we can manage that. And then you get home and it's not just a little bit of upset, it's a lot of upset. And there are big feelings and big emotions and big issues to deal with at home that can sometimes be very straining on not only the relationship between the child and the parent, but also relationships within the family.
Mm-hmm.
So the outpatient OT would hopefully help work with being able to provide strategies and to help the emotional regulation of that child, and things that are at home, like where if there are any motor impairments, a fine motor or visual motor impairments that affect home skills, such as buttoning your coats, sequencing things, knowing how do, when I'm getting ready for a bath at home, what things do I have to have organized? What comes first? What comes next? Even interacting appropriately sometimes with your parents at home and your other siblings, which can be a big challenge. And so OTs help with a lot of those things. We're very holistic practitioners, and we really try to work with the whole child and look at what areas are being impacted, what areas of that child's occupations are being impacted in their lives, in their daily lives, their occupation as student, their occupation as child, their occupation as daughter or son. That's what we mean when we say occupations, and how those occupations are being affected by their special needs, and how we can help as OTs to assist with providing strategies, techniques, and also not only help the child, but help the parents learn how to interact and deal and manage those issues in the home environment.
That's awesome, because one of the questions I was going to ask was about what are the red flags. So it sounds as if you're saying if there's any task that your child might be having what seems like more difficulty completing than you would expect, then that essentially is a red flag that an occupational therapist might be able to shed some light on. Is that correct?
Yes. If it seems that it's more so than others, or even sometimes when it comes to the sensory realm, less so than others. When we talk about sensory processing, we look at over responsiveness or under responsiveness, or difficulty regulating over and under responsiveness. There are obviously times where it is appropriate to be over responsive. For example, if there's a fire, oh my goodness, yes, we need to have an over responsive reaction to that. However, it really ends up being an issue of some literature that I've also studied in the kind of social thinking, zones of regulation literature that's out there, where it's size of the problem and size of the reaction. So my son has had struggles with this as well. Like when something happens and it's something like a minor disappointment, like, oh, I didn't get my favorite kind of ice cream for dessert. You might have a more you might be like, oh, I'm really disappointed. I'm really kind of bummed out. I didn't get it. Whereas if you have an overreaction to something like that, it might be like, I didn't get my favorite ice cream for dessert. This is the end of the world. This is the worst thing ever. I'm not going to be able to eat ice cream ever again, and I won't ever get that flavor again. And the reaction is just so disproportionate to what a typical reaction to that disappointment might be, and really extremes whenever you notice things that are in extreme. And I talked about overreaction, but also when a student is underreactive, where sometimes you'll notice children that seem like nothing is going to spark an interest in them, and they're more lethargic. They seem kind of like maybe a bell or whistle goes off, and normally you would look like this and you'd alert to it, where they aren't responsive to those kind of cues, whether they be auditory or visual, and it's more so than most students. So there's both extremes, and what happens is that ends up being sometimes a safety issue as well. For example, if you have a child who is you're doing something on the stove, and the child happens to touch the burner that was turned off, but it's still hot, and they're like, oh, doesn't seem to register for them. That's a safety issue. It can be as extreme as that, where they will have a safety issue with tactile processing. In that case, with being able to touch things. The sensory processing that I'm talking about is sensory processing in more than just the five senses, we have 5 senses. We have sight, taste, touch, smell, and hearing. Those are the normal 5 that everybody is familiar with. What the sensory processing literature has brought to us, and what we as OTs study as well, in this area of sensory processing, is processing of your body position in space, which is, and also your sensory processing of your balance skills, which is also known as vestibular processing, but it's kind of the relationship of your inner ear to how your body is in space. And also sense of pressure, how heavy, how much pressure does it take to lift up a light pencil versus how much pressure does it take to lift up a large heavy book or a backpack that's very heavy. Those kind of senses are our joint and muscle senses that help us to know how to react and how much pressure to put on something, and how little pressure to put on something. And another sense that is called the eighth sensory processing area is called interoception, which is your sense of your body organs within your body, like when you really get nervous and you can feel your heart beating faster, or you're really hungry and your stomach starts growling, and also when you have to go to the bathroom. So those senses are those internal senses that we all feel, and sometimes we can ignore them and sometimes we can't. But sometimes those sensory issues are impacted by special needs and certain diagnoses that students have. And ADHD can be one of those diagnoses where some of those senses are impacted.
I appreciate you highlighting that too, because a lot of these emotional regulation programs, they sometimes start with like, how do you feel when you're like, where do you feel that in your body? It's like one of the first questions they ask, and they're trying to connect like the interoceptive perception to like understanding the emotion that goes along with it, right? But if the kid doesn't have that interoceptive ability that an OT could help with, then they're not going to be able to progress so much along that program, right? So it
Right,
um,
right. And I think those programs are valuable,
oh,
but
absolutely.
again, you have to kind of, and I think that's what an OT does. I'll highlight one other thing, and I'm sorry if I'm going a little bit off script, but things are coming to my mind as we're speaking,
Yeah.
and what OTs are really, really good at, and what we're trained to be good at, is something called activity analysis. And this could be for any child or any person who has a need, not just ADHD, although it certainly does apply to ADHD, people with ADHD, is that we look at an activity and we analyze all the steps and components that are needed to carry out that activity. And what our job as OTs to do is kind of to be a detective and say, what part of those steps that you need to perform that activity is where it's breaking down. So, what part of it is not working, in other words, and so we look at those pieces that all come together to form that one activity. And we say, okay, well, we might say, oh, it's breaking down at the part where, like, let's just take, for example, I don't know, something as simple as picking up a glass. We'll say, okay, you have to put your hand in this kind of a position. You have to know how full the glass is or how heavy it is, which is the proprioceptor that I was talking about, and your joint position. Because if it's an empty can, it will not take as much effort to pick up and as much muscle strength or joint muscle co-contraction. If it's a very heavy can, it will take much more of your muscle strength to pick up. So we look at all those different steps of, okay, how much muscle strength, how high do I have to lift it? Do I need to have some shoulder? If I have to lift it up high, I need to have some shoulder strength here. And I also have to have some arm, motion. And we look at all those little pieces and you think, oh, these are things we don't even think about, which is why we have to be trained to think about them and break them down into their component parts. And that's called activity analysis, analyzing the activity and all the parts of the activity, and where is it breaking down, and where does that person need help with the component that is breaking down, and what can we do to assist that person to either gain the skills so that part doesn't break down, or to remediate those skills and have an assistive device or special tool or something that will help that person still be able to do that activity, but in a different way, because they may not have the muscle strength, or maybe they won't ever have the muscle strength to, or whatever other area, the component they need to be able to do that activity.
Mhm. I think what you're describing is helpful to me because I earlier on in the conversation, you were talking about kids having emotional meltdowns, right? So the first place my brain tends to go is, well, isn't that the area for psychology? And I think, I'm guessing, tell me this is what you think. It's really that we're just approaching it from two different aspects, right? And when you put the two together, then you can really begin to understand the whole picture of what's going on for that child, perhaps, right? Because the psychologist looks at it from the cognitive abilities, right? And then the occupational therapy would be looking at that same thing from, as you're like, I love that explanation of the cup and all of the different steps that are involved in that, because then it makes that emotional component make more sense, because maybe there's some steps in the way that the child is having difficulty with.
Right.
And that is why an OT would also add value to addressing the emotional responses, right?
Yes, absolutely. And you know, we can OTs can look at cognitive, and some OTs really look at that, and others don't. We are specialists, but we tend to be, like I said, because we look at the whole child, we tend to be jacks of all trades as well, because we are looking at the person and their whole needs, not just one little part of their needs. Although we do, as I said before, we do obviously break down the activity into the component parts. We also look at how it affects the whole child, and it's important because a child could be having a sensory, or quote unquote a sensory processing reaction or a reaction for a number of reasons, and you have to kind of tease out what those reasons are, and the psychologist would definitely be able to figure out neurochemically and maybe emotionally, and those aspects that might be affecting the performance, as you said. But I might be able to say, well, maybe his interoceptive system isn't working right today, and he has a stomach ache, and that might be contributing to it. And that might be something that the psychologist wouldn't be thinking about.
Mm-hmm, mm-hmm.
Yeah. So I think, yes, I think that OT can complement a number of different other therapies that specifically people with ADHD need, but also other people work with. And actually, I don't practice in this area, but there is a area of psychosocial occupational therapy as well, and there are OTs that specifically do work in mental health field, with a variety of mental health diagnoses as well. But that's not my area of specialty. But I did do a internship in it when I had to do my internships for becoming a degreed occupational therapist.
Awesome. One more question, if you will. As you've been going along thinking about locating somebody to work with your son, right? Perhaps you could share from your experience, what are the types of questions that you ask, or what would you recommend to parents to ask as they're looking for an OT to address ADHD specifically?
Oh, sure. Well, I would definitely, it is a process. And as with any therapist, you have to be comfortable, working with the person. So really I know that they tend to be interviewing you a lot and your child as the patient or the person in need of therapy. But I like to interview them as well and ask them some questions such as, kind of what kind of training do you have? I'd like to know, do you have experience working with people that have a diagnosis of ADHD? Is it adults or children? Are you, obviously you want to find out if they have all their certifications and their credentials, um, and ask them how much experience they do have in working with either children or adults with ADHD. You'd ask them, how are you going to evaluate my child? And what areas are asked. I would ask them, are they going to evaluate? And if most likely they would probably evaluate fine motor, sensory processing areas, sometimes gross motor, by meaning, and what I mean by that is different from a PT, but working on bilateral coordination skills, the ability to like coordinate eyes and hands and arms and legs to move together, because sometimes that presents as an issue for people with ADHD. And also I might ask them, what goals they would recommend if they did once they did the evaluation, what goals they're recommending and why. Um, and yeah, kind of like what treatment modalities they might use. Some people in the sensory realm, they tend to have a lot of gym, like sensory gym kind of equipment. And so it involves a lot of larger like therapy balls, like the yoga balls that you see that are popular today, mats and obstacle courses and all kinds of suspended swings and suspended equipment that can help with the child with integrating some of those sensory needs and some of those sensory skills that they need to develop. So that would be the outpatient model. The educational model, the OT would more work on the needs that the child has in the classroom, and would provide sensory suggestions for the child in class. Like they might need what they call flexible seating nowadays, which is more like, a different kind of chair to sit on rather than just a regular standard chair. They might need a ball chair. They might need a what they call wobble stool. They might need some ability to have a cold drink available for sipping water or for chewing on some gum, or they might need some other a tactile fidget tool just to kind of keep their hands busy while they are working to help with their focusing. So OT in the school would more be remediating with strategies and accommodations, and wouldn't really work as much on the sensory piece as intensely as they would in the outpatient setting. Again, the sensory would be more of a how suggestions and strategies and tools to use. And then if there were residual or other concerns such as visual motor and handwriting skills is a big thing. A lot of people think that, and we do handwriting, but we're not just the handwriting helpers, so to speak. We look at all the components of what handwriting entails, and sometimes that breaks down into difficulties with fine motor skills or proprioceptive, where they don't know that they're putting that much pressure on their pencils or on their school tools that they're using. So that's kind of how OT would be remediating or helping or providing interventions in both of those settings.
Mm-hmm. Thank you. Thank you for sharing. I do think that helps to clarify again the distinction between OT within the school setting and OT outside of the school setting. So appreciated. And as we wrap up this conversation, there was one thing you'd like to highlight about this area as it relates to OT and finding your OT or knowing if you need OT? What would that be?
That's a good question. I guess I would like to highlight, I would say, really find somebody that you trust, that you think will have a really good relationship with your child, if it's specifically for your child, because and somebody who will listen to you. I think that's a really important point. Somebody who will listen to you and your concerns and take those concerns and really work as a partner with you, as a collaborative partner on your child's, team, for lack of a better word, that, where what I've found the best relationships with not only the clients that I've served in the past, but also with the therapists that I'm working with now with my son, are the ones where we view each other as collaborators in the care for the child, and a team that is doing everything that we can to help the child and benefit the child and their needs. I feel that's very, very key. Really being able to work together and have open communication and honesty, and being able to acknowledge, like, I'll work with what you're telling me to do, but I also need you to acknowledge these are some of the challenges and concerns that I have as well as a parent.
Mhm, mhm. Well, thank you so much, Melinda, for being here today. And it has been a pleasure to speak with you. And thank you for contributing to the conversation as a whole and sharing your expertise with us.
Thank you very much. It's been a pleasure and I really enjoyed it very much.
Wonderful. And we'll talk to you later. Bye-bye.
Thank you. Goodbye.